Hi, this is Steph. This is another video, this time an overview of the management portal. So in the previous videos, I'll share screen now. We've shown you the app's homepage, Health Hub, Your Surgery, and the What's On. So please do view those photos to find out more about that. But we're going to show you some the management portal now and what that can do. So as previously stated, the portal, and when the website offering is live, the portal, once we update anything in the portal, it will update the app instantly, also the website, and also the live living practice leaflet document. Again, to put everything into one place for you guys as practice managers, because I know you're busy and sometimes you don't have time to do that. And again, a reminder, this is a fully managed service. Whatever you send us, we can update and build anything for you in the portal. But let's take a look now what we can do in the portal. So I'll share full screen. Okay, so on the first page we come to, it will always default when you log in to practice details. And here you can update anything on your practice details. You can update, also by the way, you can download a list of all the patients who sign up. So you can have a cumulative list of sign-ups by week, month, year, to see how many patients are actively signing up. And you can see total app users here as well. So you can see how many active app users you've got very quickly. You can update your opening times. You can make them active or inactive. You can put a photo change or upload a photograph of your current logo or a photograph of your surgery. You can put an email address in if you wanted to. Again, we discussed in the last video live chat that's now available for some surgeries. We're trialing at the moment. We'll go through that again in a different video. Your website details, Facebook or Twitter if you have them. Again, we build all this for you at the time that you ask us to. So we populate this for you so you don't have to. But the forms, any non-clinical forms you want patients to fill in. And by the way, some patients now who are moving away from any online triage provider are now asking us to also build requests for appointments, urgent and non-urgent. They come through as a form submission, so we can build those forms for you. In addition, we can make all of these available or not available. We can link to your online triage provider for non-clinical forms if you have them, and you can choose to have them coming in by email or into the management portal if you don't want them coming in by email and just want to leave that email inquiries or admin for any sort of attached staff like nurses or hospitals. If you want to manage all patient forms in the workflow management system, which again is discussed in another video, you can just make that selection there. Again, you can enable or disable any of the buttons in the app. So if I go to the app's homepage, if I wanted to disable order repeats, or I don't know, if you don't want to offer book appointments online, simply come into here, search for book appointments, and then just untick that and save, and then that becomes not available in the app for patients to view. So if I click on refresh now, then that button for book appointments has disappeared. Again, practice managers asked us for a drag and drop facility. So some practices may want medications, order repeat medications at the top of the page. So you can see currently it's the third selection down here. But if you want it at the top, you simply drag that up to the top and click save, and then that will rearrange your app's homepage. And the first button patients will see then is order repeat prescriptions. So you have that flexibility to arrange the homepage in a way that you want to. That's something we've built in now as requested by practice managers. Let's scroll down a bit further. So we've done home screen links. Again, we build this, or this may look confusing to you, but there's lots of buttons in here. But again, we build this for you so you don't have to. We touched on this in the last video, patient surveys. So you can do this as a practice and as a cluster or a PCN. So if you are running any kind of survey, access survey or whatever else, we can build that for you digitally, or you can do it yourselves. It's very easy to do that on Office 365 or on Google Forms. And then that's fully automated for you, isn't it? All these services, they arrange all the patient submissions into a report for you. You can have that as a group report or on an individual basis, and we can enable that in the app and then make it available. Again, I said, we can do it on a practice-wide basis or on a cluster PCN basis. And as we showed you in the last video, we can send that out as a notification as well. So you don't have to print them out anymore or ask your receptionist to give them out after in reception and then have to collate them and put them into an Excel spreadsheet. You can let us run it automatically for you, and you can send it as a notification. You can use our template to run patient survey. You can change that to cluster survey if you wanted to. Again, it'll populate that notification. If you're English in England, Scotland or Ireland, the Welsh translation will not show up for you. And then, as I said, you can link that to your patient survey, send it to all users, and simply click on send. There is no cost at all to sending out notifications, unlike texts. It's completely free. And then when I refresh, it's come through my phone and on my watch. And then when it comes through, there it is, the patient survey. Please help us to value and improve our service by kindly completing our patient survey. Patients can click on it, access the survey that you or we build, and then you can run it for a month or however long you want to run it, and it collates all the information, all the results for you. So again, that's a really good resource in the app for you. Let's go down and see what else is there for you. So if you do have branch surgeries, we can put that in for you. We can build a list of staff, or you can do it yourself. There's an about us section, out of hours information page, and also if you do run private services, we've imported the template from the BMA of what you're allowed to charge for. By the way, if you want to edit anything in here, if you find it difficult to edit here, you can make the screen bigger just by maximizing, and then that'll give you a bigger screen to edit. It's much easier. If you don't offer something, just highlight it and delete it, but then you can put your price in here. We also now do allow a link to online payment. If you do offer that as a surgery through your bank, patients can prepay for certain services, which are available here. And when you do prepay, if you do offer that service, you can build the charge rate in. I believe merchant services have that functionality, and you can link that through then for patients to prepay. So that function is available in the app. Okay, so that's the hub. When you log in, the practice details always default to this page. But then we have patient information pages. So it's very easy. So these are things like this here. If I go into the app, these are information pages here, like how to give blood, hay fever advice, cancel appointment, Silver Cloud, free online mental health therapy, anything like that. You can send that information to us. We will build the information page for you, and then we'll tell you when it's done, and you can download it as a template. For example, here we've done lots of stuff here, or you can simply build it yourself. And it's much the same as Word. You can put in, I don't know, COVID information, whatever you want, and you can type away, and you can select the position for it. You can put it on your app's top, home screen at the top or the bottom, or your surgery page or the menu, and make it inactive or active at any given time. So that's an information page. We can also link those behind buttons. So if you want, for example, a good example of that is book an appointment. You may not allow patients to book appointments for everything. You may allow them to book appointments online for nurse appointments or dressings or B12 injections or BP appointments. So we can build an information page for patients, telling them what they can book online and what they can't. And that will lie behind the button for book an appointment online. So please do let us know. Send that information to us, and we can build that information for you. Okay, let's share screen again. News. You can put a news event on if you wanted to. We did cover this in the last section. You can add a news event, or we can do it for you. You can put an image there. You can upload it from your directory or from your desktop. Let's just click that now for eConsult. And you can put expiry date on it, so it expires at a certain date. And if it's an important news item, you can then click on News Flash, and in the app, it'll then appear as a news flash here. So patients really get to see that the first thing they come to on the app's homepage then. And go through and just put a title and whatever the news information is. And then that becomes available. And when it's past the expiry date, it'll disappear from the app automatically for you. Events, we covered that in the last video, and then but you can view that. And then health resources. Now, health resources is this button here called I want help for my condition. So again, we have covered this, but just to go through it briefly, this is again we've built this for you, and it has a default directory of all the we've imported the entire NHS health resources library into here for you for your particular country. But if you had a localized pathway, you can add your own health resources in as well. You can add it in, and then or you can send it to us and we can build it for you. Okay, custom form builder is the next. So we can build any custom forms that you ask us to. So there are examples here. Let's see them all. We've got lots of examples for acute prescription request, book a blood test, submit a photo, notification of change of address under UK GDPR, request a sick note, tell us if you're a carer, nominate a pharmacy. Lots of forms. And if I go into a form here, like this, and edit it, we can put it into an email address, or if you choose to manage that in the workflow management system, it'll come into there. We can put the title, description or instructions for patients, and then we can add as many fields in as we want for you. We can build the form for you, or you can do it yourself. It can be bilingual, and it can have fields mandatory or some not mandatory. It can have file upload, whatever the form requires. It can be for non-clinical, it can be for health reviews, it can be for medication reviews, whatever it may be, we can build that form for you in the app and make it available for you then in the app so patients can submit that in any way you want them to. So those are custom form builders. So next in the app, okay, this is app users. So you have an entire list of app users here. You can export all app users to a CSV file. But again, you can also send a notification to individual patients. So much the same as you send a push notification down here to your whole practice or cluster or PCN population, you can also send a notification, just like sending a text message, but to individual patients. And again, there's no cost for sending a push notification. So if I wanted to send a notification to myself or to a patient, I've got a patient here, then I can send notification. It'll open up. You can use one of our templates. You can use a template you've built yourself, or you can simply free text. Please complete the medication review. Okay, so thank God spell check is built into this as well. You can put the content of it's the title of the notification or like a text. Content, please click the link below. And then you can link to a form, and hopefully we've got a medication review form in here, online medication review, this is an example, but that will only go to that user, that individual patient. So you can really target patients in the app with notifications. So that's only going to go to me. And then if I refresh the app, because it's come to me, it's come through, I've had that notification, read more, and I can click on it, and that form obviously isn't live, but if they click more, then that would open up that medication review page for that patient. Again, if we go into app users, excuse me, you can upload a CSV and tag the patient. So in your clinical system, EMIS Vision or System 1 or Informatica in Wales, you can download CSVs for patients who are on certain registers. For this example, let's take, for example, you want to invite patients for flu vaccines, but you only want to invite patients who are over 50, eligible for flu. You can run that report in your clinical system, download a CSV. You can upload that then to here. So upload, set a tag, so 50 over flu, and choose a file. So I think I have a file already on my desktop for this, test users. Yeah, so I'm going to do that now and upload that and set that tag. So anybody in the app who is on that CSV file is now tagged them. You can also tag individually. You can edit a patient, and you can see all their details when you go in. They've consented to receiving SMS and email. This is their phone number, their email address, first name, surname, date of birth, and a photo if they have it. You can also tag them sort of in here, but it's easier to tag as with a CSV. So now I can send a notification. Let's do that very quickly. Notification, flu vaccine is now available. Link to an event if you wanted to, and we showed you how to do that in the last, or just leave it as notifications available, but not to all users. You only want to send it to 50 and over for flu. So that's only going to go to 7 of our 13 app users who have been allocated eligible for that notification. So that's a really good way of targeting patients. I believe that COPD is coming back into the QOF register for certain countries. So again, I think the COPD requirement requires you to send the patient to fill out a health questionnaire. If the patient doesn't do that, then they may be asked to do that in a consultation with a nurse. We can build that form for you and target those COPD patients in the app and send that to them, and then they can fill it in, and it'll come back to you as a form, either by email or to the workflow management system, whichever way you choose to receive it, and then that really help you then. Okay, let's go on to the next things in here. We'll miss out reception and form submissions because that is all around the workflow management system, which we cover in a separate video. But registrations for online services will all come into here. We don't have an example now, but any registrations a patient fills out by clicking the button under here for registrations, or by clicking the main button for the quick register, all those forms are submitted, and you'll be emailed a notification to say a patient has requested to register for online services. Obviously in England it's different. You won't have this in England because you have NHS login and NHS Digital verify patients for you. But in Scotland, Ireland and Wales, we have to do the verification ourselves for the time being. So those forms come in, and you see the form, you see the patient's ID, their proof of address and a short video, and then you can process that application for online services in the same way that you would, and you can even save it then into the clinical notes by downloading that file as a zip file and upload it. Very easy. App analytics, we do have full analytics. You can see what's going on, what are patients clicking on. So that, for example, in the last video, we built a flu clinic. In the what's on, it's there. And I can now say, okay, for a date, you can say for a date from and to, and I want to narrow it down for flu. So that brings up anything that I've got in the app for flu, and I can see how many times that's been clicked. We do not collect patient identifiable information in the app analytics. UK GDPR deems that to be too intrusive. So we only collect data on how many clicks something's had in the app. It does not give you who's clicked on it. That's against the law. So we just don't do that. But any other analytics are there, and we're building more analytics into the app. How long are patients spending on each page? What are they clicking on once they click on the page? So it builds a pathway to show you what patients are doing in the app. We're adding that analytics in the next couple of weeks, so that will become available for you there. Let's share screen again. So next button is downloadable files. So if you build an information page and you want a patient to download a PDF or a poster or anything like that, you can upload that file here, or we can do it for you, and you can copy that link and then make it available to patients to download something in the app. That's just an added feature. And again, push notifications are there. We've been through this, but very simply again, if you want to build a template, so let's just say I've got a template. In Wales, we close every second Wednesday of the month for staff training. So instead of having to type that out each time, I've built a template, and I can click on use, and then that template is there. I can edit the date. So if I wanted to change that to March, I can do that very easily, and then I can send that out to everybody to say, look guys, we're going to be closed for training half day. Again, it'll come through to patients. Again, there's no cost for notifications, and like text messages, that'll come through. You're advising patients you're closed, open again 8 o'clock in the morning, and during those times they should phone NHS 111 and they can click that link to access that service. And again, there's a full audit trail there to say what you've sent out. You can see here we sent out to an individual user just now for the medication review. You can see that that's been read by me. It gives you live updates as to who's read it and when. and then you can see that I've sent out today at 5:10, closed for staff training. So that's it. That's an overview of the management portal. Very important to remember that, again, this is a fully managed service. I know how busy you guys are, so to take that burden away from you, you can simply email us anything you want in the app, and we will build it in the app for you there, so you don't have to. And again, like I said, once we have the website offering live, anything we put in the website for you will automatically duplicate as a live into your website and the live practice leaflet. So that's it. That's an overview for you of the management portal and what you can do there. The next video is all around the new workflow management system. So very briefly, I'll give you an introduction on that, to what to expect. When patients do submit forms to you, like a form here for admin query, request for a private letter, some surgeries receive those in your email address, in your email account, inquiries at or admin or info at, whatever you may have. Some managers don't like that because there's no audit trail there. They don't know what's going on with each form submission. So they asked us to build what we call a smart inbox on a workflow management system. So in the next video, we'll show you form submissions. So any forms that come through can be received not by email, they come into your dashboard here. So you can see here, this patient has submitted a request for an acute prescription request. We can view that. It's just a test form now. Actually, let's show a better example. You can see all completed forms in the top right. So let's see those completed. Tell us a request for a private letter. There we are. That's come in. It's got the questions being asked and the answers patients given, and it's got a full audit trail of who has. I'll share the full screen so you can see it. It's got a full audit trail there of who did what. So, for example, that could work well if some staff start to do something but they go off sick or they go on annual leave. This gives you a bit more of an audit trail and a workflow of what's going on with that request from the patient. So a patient phones up and say, look, I made a request, what's going on with it? If it's come through by email, you might have printed it off and put it into a workflow system. At least with this, you have a digital footprint of what's been done. You can allocate that to different staff, and you can say it's in progress or it's completed. As a manager, you can go in. And we've got full reporting around this as well, so you can run reports to say what's going on, how many forms have you completed. That may help you quite a bit. I know in Wales, from April 2020, Wales have some new access guidelines where they have to allocate or account for, through a report, for time spent on forms, on non-clinical forms, or any patient queries. So this could really help you with the reporting to say, okay, well, in the month of March, we ran 200 requests for an acute script, 300 requests for sick notes. That full reporting is built in for you. And so we'll go through all of that, the workflow management system for reception in the next video. But if you've got any queries on this video we just shown you now about the management portal, again, please do email us, support@surgeryapp.co.uk, or phone us, and we're more than happy to help. Okay, thank you.